Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Since 2010, ACCC's Trending Now in Cancer Care report has served as a platform for cancer programs around the country to know how their colleagues are addressing common challenges. It really helps cancer programs collaborate and exchange solutions. Part 1 of the 2025 report is a look at how cancer centers are navigating tech enablement, AI and BI solutions, growth opportunities, and strategic partnerships.
AI and BI are here for the duration. Technology in healthcare is changing as rapidly as technology in other sectors. And so we have to be prepared to adopt these new emerging technologies as they're coming along.
That's today's guest, Calliope Bodenhorn Payne. She's the coordinator of the virtual care team at Texas Oncology.
The big takeaway that I had from this report was just the importance of sharing the information on the benefits, the struggles, the workflows that can overcome these challenges, just to make sure that more people are able to be prepared for these changes when they do, as they do, inevitably come along.
You have an APP program at Texas Oncology that was included in this year's Trends Report. Can you tell us more about that?
If I were to explain the program to someone who was completely unfamiliar with it, I would just, explain that this program is 9 advanced practice providers who are utilizing technology to cover appointments for patients all across the state of Texas, which is a massive area. Thousands upon thousands of patients rely on this technology that we're utilizing for our providers to be able to connect with them and to ease their minds about their treatment and their diagnoses and, just provide that care on the patient's terms from wherever that patient is at, within reason.
How did your program affect the standard of care at Texas Oncology?
So it has really set the precedent for how long these patients are expecting to wait to connect with their provider, whether it be in the clinic or over the phone. They now expect that they will be taken care of in more of a timely manner, which is a fair expectation. It also has helped really streamline some processes that had been a little clunkier before. So Texas Oncology as an organization is made up of hundreds of clinics across the state that have gradually been picked up over time. So these practices that already had their own routines, their own workflows, it has really helped to bring everybody under the same umbrella, just to really just streamline processes and workflows and just make sure that all patients across the state are receiving the same level of care in the same manner.
Why do you think this report is helpful to cancer programs?
So from a high level perspective, it's so helpful for others to be able to see what steps have been taken by practices all across the United States, and it doesn't matter what size the practice is. It is just a bunch of us who want the best patient care, and are looking for innovative ways to make that happen, coming together and providing information to others who are still trying to ramp up their programs and are working through various challenges that they haven't been able to really work through yet. And I mean, that brings me down to more of that macro level, is that, it gives several people in the report gave some fairly detailed information about, hey, this is the program that my organization has started. This is how we got to the point where, it was approved and initiated. These are the steps that we took to build it. And I think that providing that information to people is wildly helpful for just making sure that patients across the United States are able to access the care that they need.
And then your team was featured in the report for a new creative way to change the standard of patient care. Why participate?
Oh, I love sharing information about our programs because our virtual care team is made up of more than just our VAPPs. And so we've got a massive staff for me to be able to brag on and to just share the good word about how we're providing that increased level of access to our patients. And it's an incredible feeling to know that our team is playing such a vital role in expanding access to care.
Thank you, Calliope. You can read the 2025 Trending Now in Cancer Care Report, Part 1 yourself. Just head to the show notes. We have a link right to it. And make sure to keep an eye on this channel for a deep dive into Part 2. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.